Hello, everyone. This is Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation. Here to talk to you about what to expect after spinal cord injury at your first follow-up visit after being discharged from the hospital. Now, it's important that you follow up with your primary care physician within 2 weeks of being hospitalized, no matter what your diagnosis was. But for spinal cord injury patients, it's very important that they follow up with a physician of physical medicine and rehabilitation, and one who specializes in spinal cord injury. Physical medicine and rehabilitation physicians have been trained in spinal cord injury, um, management and treatment, and will be able to provide you with a thorough examination and plan once you are out of the acute phase of the hospitalization and ready to move on in the community. So here are just some tips on what to expect, and I hope this will also help you in guiding the questions that you should ask if any of this happens to be missed. You want to make sure they're addressed at your visit. So one, your physician should ask you if there have been any injuries or falls since you were last seen. Also, they should be addressing your bowel and bladder function. So spinal cord injuries can cause bowel and bladder dysfunction, and it's very important to make that one of the priorities in your follow-up discussion. If you're on a bowel program or a bladder program, you want to discuss with the physician what you are doing for that program, your frequency of evacuation from bladder and bowel, and if there's been any issues with that, any complications, any bleeding, any signs of infection, so they can take the proper action and direct you accordingly to have a better and smoother process moving forward. The next thing that is important to talk about is your skin. So your skin should be checked on every follow-up visit to make sure you don't have any ulcers or developing signs of an impending wound, because after spinal cord injury, oftentimes there are sensory deficits that make it difficult for you to be aware of any injuries that are happening below your level of injury. So make sure skin is discussed at your visit. The next thing is pressure relief. You should be doing pressure relief to dependent areas where you are having deficits below your level of injury, to make sure that you are allowing adequate blood supply and circulation to that area to prevent wounds. And pressure relief should be practiced every 2 hours. And this should be something discussed with your physician after spinal cord injury and reinforced. It's very important. The next thing that should be addressed is your equipment. For instance, if you have a wheelchair or any devices that you're using to help you go about your daily life, you want to make sure they are in good repair. And if there are any issues with them, you bring them up with the physician to make sure they are getting addressed. The next thing is check in on your mental, emotional, and social well-being after injury. Once you reintegrate into the community setting, it can be shocking at times, and it's very important to discuss any concerns or issues you're experiencing along these lines after your injury. Now, the other thing I always like to include is if you have a partner, to discuss with your physician how this has affected your relationship. A lot of times things don't get spoken about, and it's amazing how much anxiety and stress and negative outcomes could be prevented or intervened on if they're just talked about. And a lot of times we don't feel like we have the space to. So I encourage you to do that. And if your physician isn't asking, please tell. Don't feel afraid or ashamed to do that. That is pretty much it for now. If you have any questions, comments, feel free to leave them. And I usually will put a little blurb in if there's something I intended to say that I didn't, but sometimes I just do these as I'm going along my day because I know it can help someone. And if I've helped someone, then we've accomplished something. So I hope you have a great day, and I will catch you guys next time. If you would like to join in a community where you can receive educational content from a physical medicine and rehab provider, I invite you to go to www.freedomwellnessphysiatry.com, where you can learn more about my practice and receive more educational content for free by subscribing to my email list. And this is where you'll also learn about promotions or any updates along the way. All right, take care and God bless. Bye-bye.